to start the general session on global kidney voices. And we're going to talk about the role and some of the activities that are being done and looking at the role that patients are playing in leading the charge in driving global innovation and independence. We're going to have a series of speakers that will discuss different aspects of global kidney voices. Now, ladies and gentlemen, we're going to hear from Kathleen Tighe. Kathleen is the Vice President and Head of U.S. Public Affairs and Patient Advocacy for Rare Diseases with Sanofi Genzyme. And I've had the great pleasure of working with her on numerous occasions within the past, and I'm looking forward, as we all are, to her presentation. Kathleen?
Hi, everyone. I'm Kate Tighe, Head of U.S. Public Affairs and Patient Advocacy for Rare Diseases at Sanofi Genzyme. It's a true honor to be here today in support of AAKP, and in particular, our partnership for the Fabry disease and Alport syndrome communities. At Sanofi, our passion is to prevent and treat and cure illness and disease throughout life. We are a global company driven to improve the health of communities, including communities of kidney patients here in the U.S., and to find new solutions for patients by combining breakthrough science with advanced technology. Inspired by the resilience of our patients and strengthened by our heritage, we are always working for new ways to fight chronic, complex, and rare diseases with medicines that offer hope for patients, their families, and the future of healthcare. Within the healthcare ecosystem in the U.S., Sanofi Genzyme's U.S. Public Affairs and Patient Advocacy teams work with partners like AAKP in four main ways. First, to advance research and development. We make sure we listen to and engage with U.S. advocates to incorporate their insights for all key priority programs in partnership with our colleagues in medical and research and development. We facilitate access, partnering with U.S. advocates to improve patient access and affordability, keeping patients' needs at the center of policymaker and payer decisions, moving towards a patient-centered system. We work to improve health, collaborating with advocates, patients, and leaders in the community to increase disease awareness so patients can have informed, cooperative decisions with their healthcare teams on solutions to improve their health. And we work to be a leader in the space, to be a partner who listens, acts, and leads with the community on areas of mutual interest, always respecting the independence of organizations with whom we partner. For us in the kidney space, this looks like a few different activities, really along four main ways that I'll cover now. The first is around the initial design of clinical trials, where for our teams, the lived patient experiences and the unmet needs of the community truly inform the direction of drug development. It's important to us that we avoid me too drugs. There's no need to replicate in the system another drug that does exactly what another drug already does, but rather to solve a real need. We were incredibly excited for a new clinical trial coming for the Fabry community to understand the impact of a compound on pain, hearing from Fabry patients that although there were drugs available on the market to treat many of the disease's impacts and symptoms, pain remained a real day-to-day challenge for them and for their families and was a true unmet need. Sanofi heard the feedback from the community, continue to invest in our pipeline, and are excited to be bringing forward a new clinical trial for those Fabry patients. It's also important to us that we invest in communities where there is no current therapy, engaging early to understand what the needs are in rare and ultra-rare communities to make investments to bring forward treatments. And just because a treatment comes to market, we don't stop. So we're excited to be continuing our effort with the Alport community, which is a kidney community with very limited clinical options to care for their disease. It's important that the patient is part of our clinical research, the conduct and awareness of studies. This for us looks like engaging the community to increase awareness of the study. So partnering with organizations like AAKP, as well as other organizations in the kidney space to ensure that patients are aware of a clinical trial. Quite often research is happening at major academic centers, which is exciting, as it means there is a key investigator who's involved who can raise significant awareness for the study. but many kidney patients are not seen at a major academic center. And it's important to us that patients from across the country are aware of their opportunity to get involved in clinical research and participate in clinical studies. We hold ad boards with patients, their loved ones, their caregivers, and their family members to understand what materials and educational content will be most valuable for patients throughout the study, ensuring that there are materials available in both English and Spanish, and that they represent a variety of ways to engage with the study, both online, in print, and mail, respecting that not all patients engage and get their information in the same way. And we take feedback from the community about how our trials could be better conducted. For example, adding home nursing, virtual visits, satellite visits to improve the ease for patients to participate in the clinical research process. We're also not afraid to take negative feedback, and we've used that before to improve our studies. Protocol amendments can be a great way to address impact and input from the community. It's incredibly important to us that we continue to have ongoing investment in the communities where we're active. In the United States, we support a variety of patient organizations, both at a large national level, such as NORD or Everyday Foundation for Rare Diseases, as well as disease-specific organizations like the Fabry Support and Information Group, National Fabry Disease Foundation, Alport Syndrome Foundation, and of course, organizations like AAKP, recognizing and respecting the leadership role that they have in the community. We're very proud to be an ongoing financial contributor to those organizations to ensure that patients have access to disease education materials, patient conferences such as this one, and the support and resources that they need from their community members to navigate the complex and chronic conditions with which they live. We are proud to partner with our colleagues on the Patient Support Services team to bring disease education, offering services like genetic counseling, family tree mapping, disease education, as well as psychosocial support, support for navigating the school system when you have a child with a chronic disease, being a loved one or a partner to someone who's living with a chronic condition, to really offer that full holistic support to communities that really need it as they navigate their condition. And we're excited that we partner with organizations like AAKP to bring patient stories back inside the company. Sometimes that can be for an awareness day to ensure that our colleagues across the company truly understand the lived experience of the patients that we serve. Sometimes it can be to inform that early bench research, and sometimes it can be to advise us on places where we can continue to be a better partner to the community. We're able to hear from patients themselves, as well as loved ones, children of patients, et cetera, to really understand what the impact of the condition is and how we as a company could better serve those communities. We also make sure that we invest above the particular disease level. We understand that the healthcare system is an ecosystem, and that operating specifically in each disease area may improve conditions for that one particular disease, but is only a piece of the problem. So we work particularly with AAKP on three particular areas. We have an advocacy council that meets above disease. So I'm the head of rare diseases, but there are versions of me across the company for neurology, immunology, oncology, vaccines, general medicine, and rare blood disorders. We convene our thought leaders 3 to 4 times a year to advise the company in a standing manner on how we can be a better partner. What are ways that we could better improve our engagement of the community through research and development? What are best practices that they're seeing from other partners with whom they work? We have a digital summit coming up where we'll be looking for input on how Sanofi can improve the delivery of healthcare through digital means, things like shared decision-making tools, apps for patients, an Alexa app, which our rare blood disorders team recently launched. What are the things that we can do in the digital space to help reach patients and community members where they are, understanding that not every patient wants to always call their doctor and not every doctor is always available. How can we make sure that we're a good digital partner to them? We've also heard feedback on how we can be a better partner in the diversity, equity, inclusion, and belonging space. sharing both our own company pledge, but also taking feedback about what our responsibility is as a global citizen in the healthcare space. We were incredibly fortunate to recently have Richard Knight deliver a keynote for us at a Rare Disease Patient Advocacy Leadership Summit, where we worked together as a group of 40 plus leaders from across the space, kidney and beyond, to talk about how you really implement those DEI and B solutions at an organizational level. What are the challenges that your particular communities are facing, and how can we work together to solve it? Recognizing that the healthcare system only works when it works for everyone. Also work quite hard on policies to support access and affordability for patients, both in terms of our own affordability programs for patients as financial assistance, a global humanitarian program that this year is celebrating 30 years of providing free access to Sanofi therapies for patients around the world who otherwise might not be able to access our therapies. But also making sure that patients are empowered to advocate for their own needs, supporting education on the legislative process, how to engage your Congress member, how to tell your story, supporting Hill Days, recognizing that the patient voice in the policymaking process is incredibly important. And that affordability is a real issue for many of our constituents. And so hearing both from patients about their needs, but also understanding that advocacy organizations like AAKP play a key role, we're incredibly proud to continue to be investing in those areas. We really appreciate the opportunity to be here today to partner with AAKP to continue to deliver solutions for the kidney community throughout the life cycle, to be investing in a better future, both on the delivery of medicine and the access to medicine down the line through the healthcare system. We really hope that you enjoy the rest of the conference. Thanks for having me.
Kathleen, thank you for that presentation. And again, special thanks to you and the organization for all the work that you do for patients and your collaborations with AAKP.